Consider America to be on a wartime footing in terms of fighting this virus?
I do. I actually do. I'm looking at it that way.
The president does, and here are the results. The Pentagon mobilizing National Guard troops to help drive-through testing facilities. The Department of Veterans Affairs trying to be a backup to the healthcare system as its legally designated role. Meanwhile, veterans groups also sounding the alarm that some of the aging veteran population isn't getting the protection they need. 18 million U.S. veterans, only about 100 plus tests have been administered thus far, 42 positive. One veteran, according to this count, has died. It was the VA secretary on this today.
Whole NBA teams are now being tested regardless of their symptoms. You told us a few minutes ago that the VA has conducted about 100 tests. Is it harder for veterans to get tested than NBA players?
No, I don't think so. We just haven't had the surge that the rest of the country has had. Now, that may be an anomaly. And as Dr. Fauci said to you all earlier in the day, there's no guarantee of anything.
I'm joined now by Paul Rieckhoff, who served in the Iraq War, founder of Iraq and Afghanistan Veterans of America. Your view?
Well, the bottom line is they've only tested about 344 people across a system that serves roughly 9 million veterans. So the question is, why aren't they testing more? They can't address the problem if they don't have a real handle on how big it is. So that's where it stands at the VA. I think the bottom line here, Ari, that I want folks to understand is that the VA can be a huge source of reinforcement right now. Their fourth mission is to provide a backstop in the entire national healthcare system. And that's what we see now. Finally, the Secretary of Veterans Affairs is out in front. Finally, they're starting to put out information about capacities. Similarly, the other prong in this fight can be the Department of Defense. They could add massive logistical support. They can add all the full weight of the military, but only if called upon. You know, last week we were hearing from CEOs of Walmart and CVS and said the Secretary of Defense and the Secretary of Veterans Affairs. Now we're finally seeing the full force of the federal government to include those two critical prongs. They can be a massive source of reinforcements right now.
Take a listen to the former VA secretary on the role of the military writ large.
I called for several weeks ago the Department of Veteran Affairs to be integral in this planning effort across the country. I've called for state and local officials to make proactive requests of our national stockpile to get the ventilators and protective equipment that is available out distributed to the field. And I think that sitting back and waiting is going to end up being the biggest problem.
You've joined our broadcast before to discuss civil-military relations. You've been a leader on that in the United States. I'm curious what you think about writ large, the way that the military and military powers are being invoked. And so far, do you think we're at the right balance?
No, I think we need to put the pedal down and bring folks to this country that know how to deal with an asymmetric enemy that is dynamic, that is ever changing. You know, nobody's faced anything like this before. In the military, we adapt, improvise, and overcome. We know how to deal with tough situations. We've got huge medical resources, tremendous logistical support. You know, we say a lot in my podcast, look for the helpers. But when you look for the helpers, the military can be one of the lead forces in becoming those helpers, not just now, but for the foreseeable future. So we can't be an antidote, but we can definitely be tremendous reinforcements. And the sooner we get them into the fight, the sooner the American public will be. Better off the American public will be.
All good food for thought. Paul Rieckhoff, thanks so much. Coming up, we're going to speak to a senator in the United States Senate, of course,